Hi, I'm Dr. Leticia Vargas, and I am the new owner of Yaso Wellness Health Center. Thank you so much for being here and being live. This is our first live showing of Q&A from Dr. Vargas to the community about different topics and questions that you may have about what Yaso is, why it became available, and what was the meaning behind it, and also what kind of services we're going to offer. And also, I've received many questions from you, and so I would like to go ahead and answer those. So I will start with a short presentation, and then we'll get into your questions. So as she's sharing the screen, so this little short story behind why Yaso and what does it mean and so forth is that in 2019, before COVID, we had the opportunity to go visit the country of Turkey. And if you haven't been there, it is a very beautiful country. It has many cultural sightings and many things that I didn't even know about. I didn't know what our Asclepius, who is our father of medicine, was in Turkey. And so even though they're just sticks and stones right now and just missing parts, and he really brought that culture back. And he really was able to historically tell us what happened in that situation. And so what happened when this existed was that we had people who were infirmed or sick were sent to this area, and they were basically almost like bathhouses in the area. And what they do is they cure the infirmed. And so I kind of had that thought in my head about how do we recuperate? Because so much of us have gotten sick with chronic illnesses, mental health issues, just all the stressors of life. And so one of the things that I wanted to be able to do was to incorporate that. And that's where Yaso came to life. So the name Yaso itself comes from one of Asclepius' daughters. Her name was Yaso with the Iaso. But because people would not necessarily in the Western world kind of know what that meant, I just changed it to the Y. And so what it is she was considered the daughter and the goddess of recuperation and recovery. So when people were ill, they would go to Yaso, and she would help recuperate them from their illnesses. So I thought that was a very fulfilling name for a clinic, because many times, many of us are going to be coming in already with ill issues or with problems and so forth, and we're here to treat it. So it's a different way of thinking as of traditional medicine. So it's more of a cooperative between the patient and the medical team about how we can get you to your most healthiest self. So this is our clinic, Yaso Wellness Health Clinic. What we will have is basically on 3 tenements. One is a water and IV hydration. Second is in weight loss. And the third one is in wellness. And so as an OB hospitalist working these last 7 years in an OB emergency room, I have seen the benefits of IV hydration and what its effects are on very sick patients. Obviously, in pregnancy and in women's health, we get patients who are ill from either nausea, vomiting in pregnancy, post-operative recoveries, and also for patients who are in chemotherapies and so forth. So I know that IV hydration works and it is successful, and we can put medications to give you your best health care. With the weight loss program, we see that weight loss is very different for different people. We know that weight accumulates in different areas on the body, and that there's many, many reasons for weight to increase. And so it is such a complex issue that it's not as easy as calories in, calories out, as we've been told all our lives. It's like, oh, exercise more, eat less. Well, that works, but only to a certain extent. So what we want to do is individualize each person's plan to help them with this weight loss journey. And as we know, as we get older, we get through menopause, perimenopause, there's just all these changes of hormones that we're barely just really at the tip of the iceberg in understanding. And we know that that also increases weight gain during our aging process. And then it's about wellness, right? The wellness, and wellness, it not only incorporates physical health, it incorporates all the health, all the dimensions of wellness. When I was at Incarnate Word, we had this class where it was 9 dimensions of wellness. So it's not just one thing like we think of it, it's the multitude of everything and where we are in those capacities to be most successful. So, as mentioned before, Yaso, she is a goddess of recuperation from illness. She had the ability to restore health and well-being, and she was a daughter of Asclepius. She had four sisters, Acesso, Eagle, Hygeia, and Panacea. Now, when it comes to lifestyle medicine, there's different ways of looking at medicine. And one of the tenements that I really like and I really am interested in practicing is lifestyle medicine. So lifestyle medicine has 6 pillars that it works with. It works on nutrition, with exercise, sleep, stress management, and mental health, the ability to have community, and also how to decrease our substance use or risk factors for risky behaviors. So those are the 6 areas of lifestyle medicine. So how is this different from traditional medicine? In my participation in your healthcare, it is not about becoming your primary care doctor. It is more of becoming an adjunct to your primary care doctor. I will be incorporating other areas of wellness and of health, as previously mentioned. We know that our health is very much influenced by our other states of wellness and other states of dimensions of wellness, as I previously mentioned, which include, how is your emotional health? Is there a lot of anxiety in our life? Is there a lot of depression? Are you having sleep issues? How's your physical health? As we get older, we get less function, less mobility, we get physically injured. How does that affect our wellness? We also talk about occupational wellness. What is the state of being at our jobs? Is our jobs taking up too much of our time? Is it taking too much of our mental capacity? Are we having issues at the job where we're not getting along with others and being able to have that emotional intelligence to have a happier work life? Talk about social. As we get older, we tend to get more isolated and we tend to have less friends, or people move away or they grow apart. So really, being able to find that community purpose and that community that really that you actually jive with and that you can see yourself growing with. We have the spiritual component. Many times we have very low spiritual connection, a very spiritual energy. And it's not always faith driven, but it's very spiritual driven. And so having that connection to something higher than us gives us hope and the ability to be more successful with our lives. We have the intellectual properties, right? So as we get older, are we picking up a little bit of dementia? Are we picking up some Parkinson's issues? What other things are we learning every day? So these are little things that we can do on our part to be healthier, as well as environmental. What does our environment look like? Is there a lot of pesticides in our area? Are we able to get food from a healthier source, or more organic, grass-fed foods? Also looking to see how are we recycling, how are we being with the environment, and what is our connection? Are we going out into the environment? Are we walking through nature? Are we appreciating nature to help us with our emotional well-being? And lastly, like many of us, financial, right? Financial, there's never a shortage of ways that your money flies out of your bank account, right? So how do we become more financially fulfilled? How do we improve our financial wellness being? So the services that we offer, as mentioned before, is the 3 things, right? Water, weight loss, and wellness. Well, part of our wellness is about self-care, and we forget about that, especially women or men who are taking care of their families. It's all about everybody else before it includes us. So when we talk about our wellness programs, we will also offer additional adjunct therapies such as facials, different body wraps, and infrared sauna. The hammam treatments are more like body wraps and treatments where we can either help with dryness in skin, excoriations, if you're having a lot of acne on your body, just relaxation body wraps, cellulite weight loss body wraps. And so that's kind of in a hammam. A hammam is an Arab word that means like bath. And so they're very much into the Mediterranean type of baths. We also will offer some massage, some lymphatic drainage, hair removal, and cryotherapy. When we talk about weight loss, what it is a very individual plan for each person. Again, we are using the lifestyle medicine-based methods, and each one of us will go through an extensive evaluation and intake with a history and a physical exam and an identification on what we can do to have a best weight loss plan for you. Again, it's not just calories in, calories out. It takes a lot more. It takes a lot of emotional space, physical space, social space to make this happen. We will be offering some weight loss medications. As we know, the increase of the semaglutides, the Mounjaros, and the Ozempic have become revolutionary for weight loss. And not only that, but it has shown that it really improves our health, our cardiovascular health, our kidney health. And so these are some really great adjuvant therapies, but there are also some other medications. I'm also a diplomat of the American Board of Obesity Medicine, where I've studied different medications. And so it may not just all be about one type of medication. This is an opportunity to see what are the best medications for you to be able to make you successful on your pathway. In addition to the weight loss medications, there will be a program, and the program will be a weekly Zoom meeting while you're on the program, and there will also be individual consults as part of this program. So as we get older, we know that it is an issue where certain hormones are coming down and other hormones are going up. And as just naturally an increase for insulin resistance. So understanding these changes in your body and being able to add some hormone therapy to help you with the deficiencies and decrease these changes have made people's lives much more enjoyable. So we will offer the health for both males and females. I will be providing services for women who may be PCOS and need a GYN exam, have any abnormal bleeding, any GYN issues, adolescents for family planning counseling for patients, also patients in their fourth trimester. And what does that fourth trimester look like? So basically, when a patient is pregnant, that last 4 weeks after they deliver to the 6 weeks out is usually a desert of healthcare. And so our clinics will be able to help young early moms deal with situations, learn how to better take care of themselves, and have them have a safer transition back into what we consider their normal bodies after pregnancy. As mentioned before, with the IV therapy, I've worked with IVs for most of my life, but really significantly within the last 7 years. And I have seen a transition on when the patient walks in compared when the patient leaves. And many of this is just due to IV therapy, being able to offer vitamins for patients who are vitamin deficient, medications for patients who are in pain or have hurt, for patients who have decreased electrolytes. And so this therapy is there set up specifically to help those patients have a healthier way of living without necessarily having to incur the cost of an emergency room visit. So we will be offering a medical marijuana card. And so I am registered with the Compassionate Use Registry of Texas, and this is low TH cannabis. There are certain diagnoses in Texas that qualify for this card. One of them definitely is that you have to be a permanent resident of Texas and you have to have the card with you. The other diagnosis that this qualifies is for incurable neurodegenerative diseases, PTSD, seizures, any neurological spasticity, ALS, patients with autism, cancer, epilepsy, and multiple sclerosis. We know that THC in low doses can significantly help improve these patients who are suffering with these medical conditions. So because of this reason, we are offering this opportunity for these patients who have these specific disease processes that can qualify for this. This can be either done in person or it can be done through telemedicine. So for me, a big way of relieving stress is movement. Our clinic is also going to offer a movement room where we can offer dance therapy, or some people call it bailoterapia. There will be other programs as well as Tai Chi, yoga, sound bath with crystal quartz singing bowls. So there will be an opportunity to just be in a safe space, non-judgmental area where you can see how your body moves to be best functional and be most mobile. Currently, we will have some community building, right? Because we know the community is very important. And so at this point, we still have this walk with a doc that we do at the Southside Lions Club once a month. We meet at the Ramon Quintero building, and if you look at Facebook, you'll get the dates and the times for these. They're typically on the third Saturday of the month, but sometimes with my schedule, I may change it to either the second or the fourth, but usually it's the third. We've been doing this now for about a year and a half, and it's been really great. I mean, when do you get an opportunity to actually have a conversation with a physician and do something healthy and take a walk? So it's about a 2-mile trail where we walk around the lake, and then we discuss a health topic. Many times it could be based on the theme of the month, but sometimes when it's a fewer people, then we just tend to talk about certain topics. So this is an opportunity where you one-on-one or one with 10 can have the opportunity to speak with a doctor. And so I've really enjoyed our walks, and we have a really good time. In addition to this, we want to be able to do monthly farmers markets and vendors to be able to have a table at these monthly farmers markets to sell their goods in their creative space, because this would be a great place for people to showcase their talents. And so when we talk about our weekly discussions, this is the part where the membership is really important, because this is where you actually get access to these weekly discussions. They will be live, they'll be in English and in Spanish, and then they will be recorded for those that are members. And so we'll talk about a lot of things, not only about weight loss, even though weight loss seems to be a big deal right now, especially, for us Hispanic Latinos, that we've actually grown up on the South Side. And so it's been one of my biggest frustrations is, to lose weight and be the size that everybody thinks is perfect. So it's really interesting about how it's important to have these discussions that you may not get anywhere else. They are evidence-based. They are something that have been researched, that other researchers are talking about, and so forth. It's a way to build mental resiliency. It's also opportunities to be able to talk about other things, like how much water should I be taking in? How much protein should I be taking? What's my sleep etiquette? How can I get better sleep? This is about our journey and living our best lives. So how do we get that? And that's where our clinic comes in. That's where my team comes in and say, okay, this is what we can do to help you enhance. This is how we can help you facilitate and know where you want to go. Where do you want to be? What do you want to succeed? How are you going to feel successful and more happy? And that's where we come in. So in addition to the IV therapies and other treatments and movement, we do have a sound bed that helps with meditations, and we do have sound therapy with singing bowls. Within the weekly meetings that will be held by Zoom or either Teams, then we would be able to hear this, and you don't necessarily have to be present to do that, but it is a wonderful opportunity to help calm the nervous system, help de-stress the body, help us focus better. And so this is what our weekly discussions will do. Okay, so thank you very much for this little presentation. We will be opening up our offices at 1907 Goliad Road, and our phone number is the following. I promise you that the office is going to be amazing once it opens. We are doing telemed though. We are doing telemed visits. So if you're interested in doing that, we can talk about that. But definitely we're so excited about this coming opportunity and looking forward to helping you in this journey. I do a lot of research, I do a lot of presentations, and so I have a lot of knowledge that I can share to make your life much better and much more enjoyable, and offer treatment if we need to. One thing that I didn't mention that will maybe be offered for patients with PTSD or who are having issues with weight loss or other issues is that I will be trained for EMDR when our clinic opens. And EMDR is eye movement desensitization and reprocessing. So it's a way of reprocessing thoughts. It's a way of us being able to take something that we took negatively initially, but then be able to reprocess it in our brain to make us be able to not hold such powerful or negative feelings about that situation. And so, thank you so much.
Yes, so apart from getting in touch with us via email and phone, we're also very active on all of our social media sites, and we have been posting about this Q&A, and a lot of you did have some questions that we're about to answer. So we can go ahead into question 1. So what dietary programs or counseling services do you offer?
Okay, so speaking of the dietary, it is very individualized. Everybody goes through a very complete history and physical exam. I do like to get labs initially on many things because weight can be caused by other things, endocrine issues, specifically thyroid, insulin resistance, and so forth. So identifying what is causing the weight is really important because it helps us treat the root, not just put a patch on like, okay, let's get you to lose weight, but really to get to the root. The program is going to exist as a membership program. And so what it would be is us offering the consult, the visit. Then it's going to be at one touch point every month individually. And then we will also offer weekly sessions of different topics to help improve your weight loss journey, to help improve these lifestyle medicine principles that we've discussed. We will also be offering additional adjunct therapy. So let's say for patients who are, and this is happening right now, right? Having like the Ozempic face or having that extreme weight loss and so forth, having some of our facial therapies and our body wraps to kind of help the collagen and the elastic of our skin to kind of reabsorb so that we can, as we're going through our weight loss journey, offering these adjunct therapies to also help us feel better, look better, internally and externally. And one of the reasons that is so important for this is that all the time it is much easier to lose the weight than maintain it and keep it off. And so our purpose is to let's start losing the weight. And in addition to that, learning health tips, learning health secrets, learning things that will help you be more successful, that when you are off the medications, you continue to maintain your weight or be able to lose more weight, because that is really important. As we lose weight, as we eat differently, as we eat less, our microbiome in our system changes so that when it was so appeasing or appealing to eat like this hot dog chili footlong or whatever, now just the thought of it just is not appealing, and you end up trying to crave better foods, more healthier foods, and so forth. And so our microbiome changes, and so having those tool sets, having the guides to help you live a different life, you're going to be able to maintain those changes indefinitely. And we're here for you. This is what we're here for. This is what we're here to do, to help you in your weight loss journey and help you be most successful, to be the most healthy yourself.
All right, and so this next question is a two-parter. They would like to know if you can explain the process of a typical telemed consultation and what is CURT.
Okay, so the first question is telemedicine conference. Just as we're doing right now, it would be you scheduling a time, and then I will meet with you. It would be depending on the increment of time that we would have, either 30 minutes or an hour. And we would go through that extensive history. And then we would talk about a plan on what's the best thing for you. We'll go through some of your medications and so forth. Again, I am not going to be your primary care doctor. I'm here to offer adjunct care, adjunct advice to meet the needs that you are doing with your primary care doctor. We're talking about recuperation and recovery from illness, not a maintenance of illness or chronic illness. I will talk with your physicians, your primary care doctors. We will be more than glad to send our notes to them and have them work together in partnership to offer you the best care possible. Even in life visits, we will do the same and send our notes over to your primary care doctors, because all our goal is to make you healthier. And so working together in partnership is going to be able to alleviate both things, them taking care of your medical needs, but me teaching you health tips and health efficacies, treatments that will make you stronger, better, happier. And so that is our goal for that. And so for our CURT therapy, a CURT's a little bit different. So CURT, as I mentioned before, is a medical marijuana program. Over my lifetime and in working in an ER setting, I have seen people who have significant illnesses, special neurological illnesses, epilepsy, syndromes that don't have any medical cure. And so I have seen what a difference these medications make for these patients, and having them live a more normal life, or whatever we consider a normal life, but be pain-free, be able to think more clearer, not have all the nausea and vomiting that occurs from some of the side effects of the chemo treatments that we're using. So I know that it does good for people that need it. And so we will be able to offer these medications. As I mentioned, there's only a few of those illnesses. Mostly, as a reminder, it's some neurospasticity, that's a chronic thing, epilepsy, cancer, post-traumatic stress disorder, um, are a few to name. ALS is another one. So if you have these, and multiple sclerosis, if you have these diagnoses and you think this is a good medical treatment for you, we can offer it. It comes in tinctures and edibles. It does not come in a smoked form. We will not have any of those medications at our office. The way it works is we do the consultation either in person or through telemed. We see that you are qualified to do this. Preferably, we would like that you have your documentation from your primary care doctor to let us know that this is your diagnosis. And then we send this information over to Austin, where there's a database there, and then they let you choose which dispensary you would like to get the medication. So again, we will not have any of these medications at our office, but we will be able to get you the medication close to the closest dispensary near you.
And so we are at the beginning of May already, which means we are accepting telemed consultation appointments. And so our contact information is right here on the screen if you all would like to book an appointment, whether it is just for a simple, wellness consultation, or if it is for CURT, we are accepting those appointments already. And so for our last question, they would like to know, how does emotional wellness impact our overall health?
I'm listening to a podcast right now that was done at South by Southwest about even your workplace. Fortune 500 companies, those that show that had the happier employees made more money. I mean, it meets your bottom line. Emotion obviously is in everything that we do, but it is a mindset. Naturally, we're always been meant to be in a negative state. Why? Because we had to be wary of the saber-toothed tiger earlier in our evolution, right? We're always meant to not think that everything's gonna be positive because something bad can come in it, right? We're not perfect. And so that having that ability to have that emotion and how it runs and helps us is really important. We have to relearn what the definition of happiness or emotional states. And so this is a journey. The journey is a beautiful part. We always think about things as a destination, but this is a journey that we're going through, and being able to have that positive mindset. And that's what we want to be able to offer as well at our clinic.
Beautifully said. Thank you so much for answering these questions. We will be aiming to have these Q&As at least once a month, maybe a little bit more closer to our opening date, just to give everyone a clear space of what we're aiming to do, and hopefully can provide once, the time comes for us to open. So I think that was it for our questions today, unless you wanted to add something else, Dr. Vargas.
I would say that everyone is welcome. We're here to take care of humankind, both males and females. I know most of it looks like it's aimed towards females, but truly we do appreciate our male clients and our male patients, and we have no issues with this. So please don't feel put out by it. We welcome all. And so this is a safe space for all. This is a safe space for us to figure out where it is that we want to be, and then also how do we get there. And so that is what I'm here for. Thank you.
Amazing. Thank you so much. And again, we are active on all of our social sites. And so I'll go ahead and add those on there as well until next time. But you all can keep the questions coming, guys. We will be having another one next month. Thank you.
Thank you.